So, Dr. Klatt, we're very much looking forward to your Grand Rounds presentation entitled Workplace Wellbeing and the Intersectionality with Integrative Medicine and Health. Can you give us a snapshot of what you'll be speaking about?
Workplace well-being for healthcare professionals, which I define as anybody who works in the health system, because we all impact each other's either stress or each other's well-being, is a perfect place to introduce integrative medicine and health. Because if we can introduce it to the healthcare professional and they can understand the difference it makes in their own embodiment, then I think they are more likely to suggest it to their patients. And so that's why I think it's the perfect intersection. Integrative medicine and health has so much to offer so many people, and to have a pragmatic way to introduce it to the regular everyday person is, to me, the way to get your biggest bang for your buck, to really get the message about integrative medicine and health out there. And so that's what drives me, and that's what I find fun. And to have people enjoy their work more, I can't imagine a better way to spend my time. So I learn a ton every day from all of the participants. It's been a great learning experience for me.
Can you tell us how you got into this work?
So I'm a yoga teacher, and then I went to John Kabat-Zinn's training for mindfulness-based stress reduction, and he is just the guru of mindfulness and really of translating it into the Western mindset. And I just thought it was so brilliant. But I also thought there's no way a working adult could do a 2.5 hour meeting per week and an hour of meditation a day for 8 weeks. I knew I couldn't. And I thought, I wondered if I added music and if I increased the amount of movement in and shortened the time for an hour meeting together a week and did it at the work site, if we could get similar results. And honestly, I started asking that question in 2003, and I've spent the last 20 years answering that question through research, through bringing it to different hospitals, all with healthcare employees, to see the impact, the social impact of doing mindfulness together, and to do it sponsored by the organization. That's where I think the power comes, that when we do mindfulness just as individuals, we can get a lot out of it. But when we can do it as a group where we spend the majority of our time, the workplace, if we can experience that together and have the organization actually sponsor the programming and encourage it and provide spaces in which to do it, I think it's a win-win. And it has a double effect because it is a way to expose people that never otherwise would have been exposed to an integrative technique, to the technique themselves, so that they can spread it to others.